This is my audience.
The question is not, can they reason, nor can they talk, but rather, can they suffer? Animal testing has been debated for years, but a definite is it right or wrong has never been decided. Today I will be telling you a summary and some facts on animal testing, as well as some different types of animal testing and some alternatives. Over 100 million animals are used every year in the United States as models in biological and medical research to study human disease, development, and psychology. In particular, animal research is generally recognized to be costly, time-consuming, and unreliable, and much of the research is neither appropriate to use or applicable to humans. Natural differences between animals and humans lead to very different reactions to various stimuli. An entire industry has been built around supplying animals for research that treats animals as tools rather than as thinking, feeling beings. Class B dealers buy and sell animals solely for research purposes. These dealers obtain animals from auctions, through pound seizure, from free-to-good home ads, and through other means that are sometimes questionable. Class A dealers purposefully breed animals for use in experimentation. These animals are bred as research tools, given little acknowledgement as thinking, feeling beings, and instead considered tools of study. Scientists use animals in biological and medical research more as a matter of tradition, not because it has proved to be successful or better than any other modes of experimentation. The biomedical community would instead be better served by promoting increased funding and research efforts for the development of non-animal models. Animals are living beings, and animal experimentation by its very nature takes a considerable toll on animals' life. While most scientists are well-intentioned, focused on finding cures for what ails us, some biomedical researchers fail to recognize or appreciate that laboratory animals are not simply machines that produce varieties of data. Animals in laboratories are frequently treated as objects that can be manipulated at will, with little value on their lives beyond the cost of purchase. Animal advocates, as well as many scientists, are increasingly questioning the scientific reliability of animal experimentation. Some of the main limitations are animals do not reliably predict animal or human outcome. Obvious and subtle differences between humans and animals in terms of our anatomy and metabolism make it difficult to apply data derived from animal studies to human conditions. For example, penicillin is toxic in guinea pigs, but has been an invaluable tool in human medicine. Morphine causes hyperexcitement in cats, but has a calming effect in human patients. Even with using the same species, differences can be found among different sexes, breeds, age, and weights. 9 out of 10 drugs that appear promising in animal studies go on to fail in human clinical trials. Because of the differences in humans and animal drugs and procedures that work in animals often fail when used on human subjects. A significant amount of time and money and animal lives is wasted in the process. For example, Pfizer reported in 2004 that it has wasted more than $2 billion over the past decade on drugs that failed in human testing but worked in animal testing. Alternatively, drugs and procedures that could be effective in humans may never be developed because they failed well in animal studies. Animal studies are flawed by design. In addition to the fact that animals make poor substitutes for humans, the design of animal experiments is often flawed, making it much more likely that results obtained from such studies will be useful to humans. Some types of animal testings are the eye irritancy test. In the test, a substance is placed in one eye while the other eye serves as a control. This test is usually performed on rabbits. The rabbits are restrained, preventing them from responding naturally to the irritation, and their eyes are evaluated after 1 hour and then at 24-hour intervals from 14 days up to 3 weeks. The rabbits suffer from redness, bleeding, ulcers, and even blindness, and are likely killed upon completion of the experiments. Acute toxicity. Acute toxicity testing is used to determine the danger of exposure to a chemical by mouth, skin, or inhalation. For decades, acute toxicity testing meant poisoning large amounts of animals in lethal dose 50 testing, which is conducted until at least one-half of test animals die. The lethal dose 50 test is conducted infrequently now as it is being replaced by several new, but still lethal options. During these tests, During these tests, animals endure excruciating pain, convulsions, loss of motor function, and/or uncontrolled seizures. The animals are killed at the end of the test so that an autopsy can be performed to determine internal damage. Skin corrosion/irritation. Skin corrosion tests assess the potential of a substitute to cause irreversible skin damage. Skin irritation tests are determine the level of damage caused to skin, such as itching, swelling, and inflammation. Both tests are typically performed on rabbits. The skin irritation test is often referred to as the Drazy skin test and involves placing a chemical on a shaved patch of skin and using another shaved patch as a control. Due to differences in the anatomy and structure of the skin of differing species, using data to determine skin irritation on humans is often inapplicable. Skin sensitization. The skin sensitization test is used to determine if a chemical causes an allergic reaction. In the past, skin sensitization testing is usually performed on guinea pigs who had a substance applied on the surface or injected onto their shaved skin. Now most skin sensitization tests are done by applying the chemicals to the ears of mice. The mice are killed after the testing is done. The USDA breaks down the number of animals used by the category of pain and distress they experience during experiments. No pain, no drugs, category C, mean that the animals experienced no or only momentary pain and distress. With pain with drugs, category D, means that the animals were used in experiments that did cause significant pain and distress, but received medication to relieve or treat the pain. With pain, no drugs, category E, means that animals experienced unelevated pain and distress as part of the experiment. Over 97,000 animals, 8.5% of the total, experienced unelevated pain and distress in 2010. Since its beginning in 1994, the Interagency Coordinating Committee on the Validation of Alternate Methods, or the ICCVAM, has validated numerous alternative methods for use in the scientific community. Some of these methods include acute toxicity in vitro starting procedure, 3T3 cells, using rodent cells to estimate starting doses for in vitro acute oral toxicity tests. This 3T3 basal cytotoxicity test is a reduction method that minimizes the number of animals used in each procedure. Corrositex is an in vitro test to determine skin corrosion. Corrositex uses biomembrane and medical detection systems that change color when in contact with corrosive substances. EpiSkin, a model of reconstructed human epithelium developed to test skin corrosion. This method was first validated by the European Coalition on the Validation of Alternative Methods, or the VCVAM, as a complete replacement for animal testing. In conclusion, millions of animals are killed every year on experiments that in some instances have no benefit for us. They live their short lives in tiny sterile cages with no chance of getting out. They are deprived of love and shown only rough treatment, abuse, and death. Now ask yourself, do they suffer?